Hey Mac Performance family, it's video live tonight, and our topic is going to be headaches. Why? Because almost everyone will experience a headache at some point in their life. So again, we have our live stream going on, and if you have any questions, go ahead and ask in the comments. If you are watching this live, hashtag live. If you're watching it on replay, hashtag replay. Go ahead, click a like if you're enjoying what's going on, and let's dive into headaches. This is something that has affected me pretty much my entire life. I've always had tension headaches and stress headaches, but then as I got older, I ended up developing migraines, and it is absolutely horrific. Migraines completely knock me out and put me down for 3 to 4 days at a time. And they can really come out of nowhere. I don't have a food sensitivity that triggers them. My migraines actually come from my neck. And that's a huge issue. I've tried different medications, hasn't worked. And we'll dive into how I've learned to manage my migraines and have fewer days without having any issues. Oh, looks like we got someone with us. Hi, Tim. Welcome to the live feed. It's good to have you back. So let's really dive into our headaches. So what are some fun facts? Well, approximately 50% of adults in the entire world will have at least one headache each year. Tension headaches are the most common and they affect 78% of the population. Migraines are the 6th leading cause of disability. So a reason why someone can't work is due to migraines, and it is the 6th leading cause of disability according to the World Health Organization. And, I just got a report I'm echoing. Well, let me see if I can't clean that up. I apologize, everyone. All right. Testing. Am I still echoing? Because I want to make sure I'm not causing any feedback for anybody or having any issues. So let's see. I'm not seeing any comments that I'm still echoing, so we'll continue on. And then back to migraines, 52% of people are living with migraines but haven't been effectively diagnosed. And we'll kind of go into why that occurs. Now, these are all the different types of headaches that, I'm not going to say all. This is a list that is fairly comprehensive of all the headaches that can possibly occur. Now, there are other ones, so if you don't see yours on there, it's not as common, but it is still completely a valid headache. So let's talk about tension headaches or stress headaches. These really occur when you're at work. They're this band around your head. It can almost feel like you're wearing like a sweatband and it's just squeezing and pushing on your head and really causes issues. Responds well to over-the-counter medications and to manual therapy, and is really described as like a dull, achy sensation. This is your kind of everyday frustrating headache that occurs that really is just annoying. Can be worse at the end of the day, especially after a long day of work, but doesn't really prevent you from doing anything. Migraines, on the other hand, are debilitating. It is a severe, sharp pain. Now, there is a sex disparity, meaning that it affects females more often than males. And this severe pain can be sharp and throbbing and just really affect that half side of your head. So it's almost like it wraps from the back of the neck around to the front of the eye. And that is a really frustrating thing that affects your light sensitive, your sound sensitive. You are nauseous, you potentially could have vomiting, and really the only relief you get beyond taking a preventative or an abortive medication can be laying in a cool, dark room. You can't work, you can't focus, you can't do anything. Migraines are very, very debilitating, and they are commonly confused diagnosis-wise with sinus headaches, which just is a flabbergast me that they get misdiagnosed that way. Now, some migraines are, before you actually get it, you'll have something called a prodromal. The prodromal is similar to like a seizure warning, where you actually have a symptom that occurs giving you a warning of, hey, you have 20 minutes to take a medication. Hey, you have 2 hours before I'm going to hit. For me, with my migraines, I get wavy, squiggly lines called an aura. And when I'm getting that, I know I have 30 minutes to get home and in a cool, dark place, or to get to a chiropractor and get adjusted. Those are my only ways of managing it. Other options is modifying diet, potentially looking at yoga for stretching, acupuncture, and some relaxation techniques, since migraines can be triggered by stress. Other options for headaches, one of the most horrific headache is called a cluster headache. They get their name because they occur in clusters. So you might only have this twice a year, once in the spring and once in the fall. And this is one of the few headaches that is actually has a higher specificity for males. This is the one headache that affects sex-gendered males the worst. And it occurs right behind the eye, and it is been described as an ice pick. It feels as if someone is driving an ice pick into your head as the symptom. And this one is very challenging to manage. We don't truly, from the medical standpoint, understand the pathophysiology of why people get cluster headaches. So during these attacks, the pain can last anywhere from 15 minutes to 3 hours, and they come in a cluster. So maybe you only have pain for 15 minutes at 10 a.m. for 7 days in a row. I mean, granted, that is kind of nice because you get to plan your life around that, but how horrible to have that 10 out of 10 pain for 15 minutes. This is where there have been some research studies in using psilocybin mushrooms as a potential treatment for the cluster headaches, especially when they last for 3 hours at a time. Now, our next headache is allergy and sinus headaches. 90% of sinus headaches have actually been found to be migraines. So if you've been diagnosed with an allergy or sinus headache, please follow up and make sure that the headache is managed. And I do have a question. Tim, I'm gonna wait till the end to answer that because I have a great long answer, and I will get to that question about acupuncture and headaches. The allergy headache is pain in the frontal and maxillary sinuses. It's a pulsating pain, gets worse with allergy season or if you have a sinus infection, and responds really well to over-the-counter decongestants. So if you're having what's diagnosed as a sinus headache and you're taking those decongestants and not getting a response, you need to follow up and find out if it could truly be a migraine headache. Our next headache is a hormone-based headache. This goes back to being a more female-based headache. It is traditionally associated with high estrogen levels, and those high estrogen levels really cycle with our menstrual cycles, our birth control, and with potential pregnancy. And these headaches can be just as debilitating as migraines. And they have that kind of almost outward head experience versus being inside the head for pain. Our next headache is a neck headache or a cervicogenic headache. This is how my migraines are triggered. It's from my neck. And I can tell you mine are upper cervical. When I have my neck well managed with a chiropractor, I usually get adjusted every 2 weeks. I don't get headaches, and I don't have to take any medications. I was on a preventative med and an abortive med. I was on Imitrex and those things, and I don't have to take them anymore. And I don't have headaches. I might get one migraine or headache a year now, and then I'll have occasional tension headaches. But this, if you have cervicogenic or neck-based migraines, you gotta see a chiropractor. The one time I'm gonna say it, you have to see them. This is really where you're gonna have the benefit of not having those symptoms. Now, our next headache is our TMJ. Now, when I was little, my mother was a physical therapist that specialized in TMJ, and I thought TMJ stood for tooth, mouth, jaw, which her and her PT friends thought was just the cutest thing ever. But it actually stands for the temporal mandibular joint. I think tooth, mouth, jaw is so much easier. But that is this area right here, and it really causes pain in our temples. Now, a common cause for this is called bruxism, which is clenching and grinding of the teeth at night. Really easy to prevent with a mouth guard if you'll wear it. A lot of people won't wear their mouth guards because it's uncomfortable, or they'll start with it in and then they'll spit it out at night. So you really got to play with different brands. There are a bunch of different mouth guards on the market. You got to find the one that you'll actually wear, and then this will help. Otherwise, seeing someone, a chiropractor or manual therapist, to have the muscles in your jaw release can really give you a lot of benefit. When I have someone coming in with jaw pain, I treat them. It's a lateral pterygoid. You actually go up inside the jaw and hit a muscle back here, so you're inside the mouth. And I teach them how to do it so they can treat the muscle themselves. And I recommend that you do it in the shower. 1, it doesn't feel good. Shower hides the tears. And 2, you drool. And it's just less messy. Our next headache is going to be the caffeine headache. Headaches with caffeine can either be from being addicted to caffeine and not having enough, or because of the effect on our vascular system, caffeine can cause headaches. So it both helps prevent headaches and it can cause headaches. So finding out which one on the spectrum you are is an important thing. Now, there is a nice little range that we can stay in with our caffeine that we don't get a headache. Now, caffeine ups our heart rate, which is similar to an exertional headache or a hypertension-based headache, because when our blood pressure increases, that can also cause headaches. Now, a hypertension-based headache is super dangerous. This can be a sign that you're having extended periods of high blood pressure, and that has to be managed with either medication, diet, exercise, because this could be signs that you're headed towards a heart attack or a stroke. A rebound headache is the most frustrating headache because it's from taking too many headache medications. You literally get a headache from taking, whether it's prescription or over the counter, you get a headache from taking too many, which then you try to prevent the headache by taking more, and it's just a vicious cycle. So that's a really challenging one that you have to manage with a provider that has medication rights. And then the last one is a post-traumatic headache that's commonly associated with concussion. Now, that's kind of a really brief, aggressive overview of all the possible headaches that can occur and what you can do. Now, for me, I have found that utilizing chiropractic has been a huge benefit. For my husband, it didn't quite work out that way. He has something called suboccipital neuralgia headaches. And Tim, this kind of dives into your question concerning, can acupuncture successfully treat headaches? So he was diagnosed with suboccipital neuralgia after he had what was described as the worst headache of his life. Now, in my field, when we have a patient come in and they're describing the worst headache of their life, I'm terrified, because at that point, we're thinking stroke. Because a stroke presents with headache and neck pain. And what do you typically go see if you have a headache and neck pain? a chiropractor, which is where we've gotten into trouble sometimes for having that kind of moniker hung over our head that we cause them. And we don't. People come in with them and then we misdiagnose them with a headache or neck pain. So if someone comes in with stating to me, hey, I'm having the worst headache of my life, it's completely different than any other headache I've ever had, I'm having this, this, and this, I put them through a stroke protocol to see what's going on, and then I refer them out to a potential stroke center for assessment to make sure they're safe. Because I don't want to become a statistic, but I want to make sure that they're getting taken care of and there is a safety range within that stroke range. Now, so he was having this headache, worst headache of his life. He had an MRI. There was increased white density on his MRI. So they were like, oh, it's possibly MS. We're both panicking at that point. They did a contrast MRI. There was no active lesions. So then we just went to every specialist in the book. We saw a neurologist. We saw a rheumatologist. We saw a hematologist. If it was an ologist, we saw them all to end up with the diagnosis of, oh, we have severe clinical depression, which is no joke. That is severe. And you have suboccipital neuralgia headaches. Here's your order to go get Botox injections into your spine. And I went, time out. You want to put Botox into his spine right at the base of his skull. Is there another option? And he was like, well, no, this is all you can do. And I was very uncomfortable with that. So we opted to go a conservative route. I was like, hey, can I take a month? We go see an acupuncturist and see if that helps. And the neurologist was like, you technically can do whatever you want. I'm really not interested. I don't think it'll work. I'll see you in a month to do these injections. So I got my husband in with an acupuncturist, and one treatment, he had no headaches. We did 2 more treatments and then have managed his headaches since then with chiropractic care. He still gets fairly frequent headaches, so he gets adjusted 2 to 3 times a week, which is convenient that he's married to me. But he just doesn't have the same severe, debilitating, can't get out of bed pain that he was having. And I really attribute that to seeing an acupuncturist. The way that they can put the needles into the muscles, into the tiny muscles of the suboccipital, really creates the relaxing effect that massage and chiropractic just can't quite get there. So when you're having severe pain with a headache, co-managing with a chiropractor and an acupuncturist is going to get you the fastest results. But when you're at home and you're trying to figure out what to do, stretch. Start with stretching. And I have a sheet, PDF, that if you're interested in, toss your email in the comments and I will send it to you. And it simply just goes through the different stretches of the neck. Start looking up, looking straight, looking down. Hits 3 different muscles. And then chin retractions. And chin retractions simply are tucking the chin in, getting all the cute double chins. So tucking the chin in and relaxing. And you can do this laying down for a little more difficulty versus sitting up. And it really kind of helps activate those muscles. Now, what's nice about the chin retractions is, going to throw it out there, also very helpful in preventing concussions and giving you control of your head. Because when we sit at our desk jobs, we get this nice anterior head carriage, forward roll of our shoulders. When we do these retractions, it activates our muscles. It helps relax the muscles in the back of our head. So if we are hit, we don't whiplash our head back and snap it off the ground. So that's a really important thing to do. So any of my athletes that are playing a contact sport or wearing a helmet that have a potential to hit their head, I'm giving them this. And I also have a sheet on how to perform that as well. So again, if you're interested in my stretching or neck strengthening printouts, drop your email below. Otherwise, I do have videos. Pardon me. Andrew got me sick. I do have videos on how to do those stretches if you're not much of a reading person and just want to follow along. I hope that kind of answers your question, Tim, on whether acupuncture is effective in treating headaches. The answer is yes. Am I an acupuncturist? No. Do I have acupuncturists I work with? Absolutely. And I love referring patients to them. Another question just came in from Ace. Why does giving myself a brain freeze help with some of my headaches? So why does using ice sometimes help with headaches? And that all has to do with the type of headaches. Migraines are typically caused by excessive blood going up into the brain, which is why they utilize medications to constrict the blood vessels. Imitrex shrinks down those blood vessels and prevents as much blood from entering the brain. So when you utilize ice, if you apply it right onto the back of the neck, right where the big vessels go into the brain, you can cause some vasoconstriction and alleviate some of the symptoms. So brain freezes can be very beneficial in symptom treating migraines. Now, remember, if you're watching this live, hashtag live. If you're watching this on replay, hashtag replay. If anybody else has any other questions, happy to answer them. If you're watching this on replay, go ahead and still ask the questions. I'll come back to answer them. Headaches are so frustrating and so common. Everybody at some point in their life, generally speaking, everyone will experience some form of headache at some point, whether it be a self-induced headache from maybe partaking too much adult beverage, if you catch my meaning, or whether it's something you can't control from attention to a migraine headache. So it really is one of those things that is super common and really can be a debilitating thing for you. Doesn't look like I'm having as many questions coming up. Next week, we're going to be doing a live on the ankle and how to get your ankle strength back after sustaining an injury. Research is changing with what we're doing with ankle injuries and how we're rehabbing them and getting them back to full strength, since it's so common. Once you have an ankle injury, it kind of becomes an ankle issue for the rest of your life. And I know for me, in high school, I pretty much obliterated my ankles playing basketball. And then I had a brilliant idea of, in college, becoming a ballet dancer and doing point. And that kind of finished them off. And the work that I've had to do to restore my ankle function so that I can keep doing activities I want. So next week is all about the ankle. The event will come out later today. So if you're interested in that, go ahead and click the interest button. And if there's no other questions, I want to thank everybody who have joined us tonight. And I hope you learned something about headaches. If you want more information, again, please comment below. Let me know. If there's anything else, we can always do another live covering some more in-depth knowledge. I try to keep it very surface, very digestible, because, we could go into the weeds with some of this information. But with that, I hope you have a wonderful evening. And here at Mobility, Agility, Chiropractic Performance, we are always trying to get you better faster, keep you better longer, because no one has time to be sidelined. And I hope everyone has a wonderful evening. And till next time, have a good night. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.